Just as my fingers on these keys make music, so the self-same sounds on my spirit make a music too. Music is feeling then, not sound, and thus it is that what I feel here in this room, desiring you, thinking of your blue shadowed silk, is music.
Joan and Eric Robinson were lovers before they married. They exchanged marriage vows, knowing she was ill with cancer.
I wanted to marry her anyway. I married her whether she was healthy, sick, sometimes sick, dying, living, resurrecting, you know. What the hell you like?
Oh, I'm feeling really tired. Must be that codeine.
Although their intimacy sustained them, Joan's condition presented the couple with many difficult problems.
Joan naturally tends to suggest that we have more sex life than we have. I mean, I suppose it's part of her defensive mechanism to say, well, you know, it's not so long ago and so forth and that kind of thing, but I know damn well. I mean, you know, if I were like Boswell and put a little asterisk in my diary, that little asterisk in my diary would come, what, once every 3 months?
People have a bias about having sex during illness, particularly a serious illness. Somehow we associate sex with youth and beautiful bodies and everything being perfect and just fine and glorious. And sex can be, you know, many different things. You can enjoy it under many different circumstances.
Hello, I'm Meryl Streep. This film is about a troubling and sensitive question for men and women who live with illness or disability. Most of us spend most of our lives seeking, expressing, and perhaps yearning for love. But what happens to our capacity to love when illness takes over? How do we manage sexual feeling then? Many couples avoid the question. They back away from their sexuality. But our bodies don't give up. Even a suffering body continues to be capable of making love, to invite and welcome embrace. The sex instinct is part of our will to live. In medical practice today, the old polite evasions of sex during illness no longer apply. Sexual love is viewed as important for both the sick and the well partner. Joan and Eric Robinson allowed themselves to be filmed because they felt other people could benefit from sharing their experience. The sequences were filmed as they actually happened. Where you see cigarette smoking in these scenes, that's what the camera caught. We asked physicians and therapists to discuss sexual experience during illness, including the difficulties that people create for themselves. We interviewed counselors of mind, body, and soul.
The desire to seek sexual relationships is a
Dr. Bernard Towers, professor of pediatrics and anatomy at the University of California in Los Angeles, and co-director of the UCLA program in medicine, law, and human values.
That everyone has imperfections, handicaps of different types.
Dr. Alvin Poussant, associate professor of psychiatry at Harvard Medical School, and associate in psychiatry at the Judge Baker Guidance Center in Boston.
For people to feel that what's happened to them.
The Reverend Julius Sibley, Episcopal priest, chaplain at several large New York City hospitals.
The basic principles that we're enumerating here of communication.
Leon Zussman, MD, obstetrician and gynecologist.
One of the difficulties in communicating about sex is that
his wife and colleague, Shirley Zussman, PhD, psychiatric social worker and psychotherapist. The Zussmans collaborate as sex therapists. They are directors of the New York region of the American Association of Sex Educators, Counselors, and Therapists. We all have preconceptions about sex during illness. Matters of taste and delicacy, as well as physical ability, present themselves. Eric Robinson learned that he had to overcome many obstacles to desire.
Here is this woman with 2 bags fitted to her belly into which excretes glass, right? Now, how is it possible to be sexually attracted to such a person and to have a sexual relationship? I mean, am I going to be put off? For example, I've never seen the colostomy. You know, what is it? What is this wound, right?
I think this belt's getting too tight for me.
Okay. Naturally, I thought to myself, who wouldn't think to themselves, who'd never encountered such a situation, how will I react? Will I, in fact, be repulsed? Right? And I can say that I wasn't.
I think we have to face the fact that there are partners who find it very difficult to accept a deformity, but that is not true for most people, and it's usually not true where there is a close, intimate relationship, a feeling of caring and tenderness and concern. That deformity is only one part of the person.
Before I had my colostomy, I didn't know what it's going to look like, you know, and I kept waiting for it. So I had imagined that it would be skin-colored. Well, this nurse came around and said it was going to be, well, she said it's going to look like a rosebud. And I said, a rosebud? I said, what do you mean it's going to be red? She said, yeah, it's like the inside of your lip. I was so disgusted. You know, they told me at the stomach clinic that it was a beautiful stoma.
Yeah, well, the best you've ever seen.
Yes.
Oh, you must have had a beautiful stone.
We feel sex is perhaps the most intense form of communication. It is in itself a way of communicating, a way of relating, a way of opening up our inner selves to another human being. And therefore, not only is it a way to communicate, but it is necessary to communicate about sex, to express one's needs, one's wishes, one's desires to your partner.
I have to say that it is a very considerable deprivation to me as a man and as a human being. Yes, I feel starved.
There are some diseases more than others which have a peculiar component in the sense of reducing the level of sexual achievement that a patient may be capable of experiencing. There are some which lead to, unquestionably, to a real impotence in the sense that the patient may be incapable, either male or female, of engaging in the kind of full sexual union that normally leads to orgasm. I think it's very important that such patients be counseled to the effect that this does not mean the end of their sexuality, that it does not mean the end to loving, to tenderness, to affection, to caring, but in fact might provide an opportunity for them to explore some of those alternative modes of expression of sexual affection which many of us, unfortunately, do not tap into.
It's just damn painful.
Lost interest, it's that it's painful.
Well, it's a combination. I mean, there's no doubt about it that we're told that the chemotherapy reduces your sexual feelings, right? So she is less, she doesn't feel sexy, right?
Eric and I, recognizing how we're communicating with each other, being more...
Joan tried to deal with her confusion about sex by visiting a psychotherapist.
What happens to the old Catholic guilt? How do you feel about the guilt for your sins of omission, commission, whatever?
Well, then I think, well, that's a bunch of malarkey. That, you know, that they laid this on me when I was too young to know any better. And, you know, that indeed I wasn't that sinful, or, you know, that my behaviors were explainable in a number of ways, and, you know, I shouldn't have to suffer for them any more than I've already suffered.
So even if there is a God, and even if there's afterlife, it maybe not so bad? I mean,
Yeah.
even if?
Well, I do feel kind of bad.
You do?
Well, I feel guilty about having had affairs with married men.
And what does the church say? Is that a bad sin or a medium?
Sure.
It's a bad one.
Are you kidding me? Not allowed, Edna.
Yeah, but there are different levels.
You're not supposed to have an affair anyway, with married or unmarried men. You're not supposed to go to bed with anybody you're not married to.
Whether we're well or sick, the way we feel about ourselves sexually determines how we express our sexuality. So we've really got to understand that we've got a right to be sexual whether we're ill or well.
Sexuality is a beautiful gift of God, and we are to use it. And to feel that we're being punished for the use of that wonderful gift certainly is against anything that the church or community of faith should be teaching.
Now, I think it is true to say that the problem was greater for Joan because of her need to feel herself desirable.
One of the things that often accompanies chronic illness is the fear that we are no longer sexually desirable to our partner. And that fear often keeps us from being sexual. It keeps us from reaching out and touching our partner because we feel perhaps he may not want to or she may not want to respond if we're physically ill or handicapped in any way. But that often is such a misconception of what actually goes on.
33 bust, 26 waist is comfortable. It's really 25 and a half. And 35 hips. That's awful small hips. I used to be a skinny kid, and it was the same thing that my mother was always shoving food down my throat. Eat, eat, eat. And I just didn't have the appetite or interest. And then when I got to be an adult and was normal weight and, in fact, overweight, then I couldn't stop eating things like peanuts and chocolate sodas.
Mm-hmm. You don't want to eat
but
that
now
anymore?
I don't have any desire for them. I mean, I like frap and I'll drink it, but I don't crave it like I did when I was trying to lose weight. But I've gotten so skinny, I hate myself.
Frequently when we're not feeling perfect, when we're feeling a little bit down or unwanted, that we need the closeness and support of other people.
If it's going to make it more comfortable for you, that's great.
It's going to show through my clothing.
It's not. We'll have a piece of felt or something like that sewn inside the dress so that it will spread the bulge over a bit and you just look a bit pregnant. That's
It happens.
Today we have increasing numbers of extremely good sex therapists and sex counselors, and the physician who would engage in discussion at the first level, as it were, as a primary physician on these topics, should be as prepared to recommend the consultation with a skilled sex therapist or sex counselor as he would be to recommend a consultation with a cardiac surgeon, if that were what was necessary.
One of the things that we do in sex therapy that perhaps is different from most forms of psychotherapy is to recommend specific exercises, perhaps we might call it homework, that couples can do at home in the privacy of their bedroom, which may begin a new way of looking at sex. So we might suggest to Tim that he invite Mary to take a shower with him, soap each other up, shampoo each other's hair, and approach it as a kind of fun thing, not a sexual exercise. After they have finished showering, they can pat each other dry. Mary and Tim go into the bedroom, and Tim might begin by stroking Mary's back of her head, feel the texture of her hair, the way it curls, the way it lies smoothly, go on from her hair to her shoulders, to her back, her buttocks. And as he's stroking her and caressing her and touching her, we recommend that he use different pressures, different rhythms, and concentrate not on what's happening with Mary. We don't want Tim to concern himself with whether he's turning Mary on. That's not the purpose. We're suggesting that Tim just concentrate on his own reactions, not concerning himself with whether he gets an erection or whether he's sexually aroused, but just what it feels like to enjoy the pleasure of her skin, of her temperature of her skin, and where her curves are, as if she's a creature from outer space that he's exploring for the first time. And when he's finished, she begins stroking Tim's back, and Tim lies on his stomach and receives this pleasure. While the couple is doing this, we recommend no talking. This is to be nonverbal, because we don't want them to give each other directions. We don't want them to be critical. We just want them to enjoy themselves.
And it's not a scar, it's just that that area is flat, whereas the other one, there's a curve there, you know what I mean?
Yeah, sure.
As a further medical and sexual complication,
I mean, I'm not really...
Joan Robinson had a mastectomy. A volunteer from the American Cancer Society visited her.
I know when I was in the hospital, I just figured it was a matter of procedure. I was sure that someone was going to come in and show me what I was going to wear. I just figured it would be... It never occurred to me that they wouldn't anticipate my emotional needs. When it came time to go home, I said, uh-oh, wait a minute. You know, they're just going to have me walking out of here with one tip, and I don't... That's not fair. So I raised a fuss, and my surgeon put me in touch with another woman who'd had a mastectomy, who I saw later, but it really wasn't quite the same. You know, I sort of wanted to know, because I was getting married in a month, 3 weeks, 2 weeks.
Oh, boy.
Wow.
2 weeks, yeah. So I had to have a, you know, I wanted to look decent at my wedding.
Sure.
So, and I thought they'd take that, I thought that maybe would even, you know, give them a little pang.
Oh, God.
You
I
know,
don't think so.
but nothing, you know, never occurred to them. So I think women are just happy to see another woman who's been there.
Sure.
The woman with a mastectomy, once she's reassured that she's still alive and that hopefully she will stay alive, her next greatest concern, and perhaps even a greater concern than her health, is, am I still a woman? Am I still sexually desirable? Because in our culture, we connect breasts and sex and desirability so closely that losing a breast makes us feel we've lost our sexual appeal.
I didn't realize they have so many different types.
They have millions of types. And actually the best type, as far as I'm concerned, if it's comfortable for you, is a silicone gel-filled, because they're just so natural and lifelike, and they bounce when you bounce, and, you know, they fall into your arms when you lie down. They do all the right things. These are temporary prostheses, by the way. These are what we give to women in the hospitals. And I wasn't sure of your size, so I brought 2.
Okay.
I was pretty sure you weren't going to be enormous for some reason. They must have given me a hint.
Well, this doesn't feel that different from what I'm wearing, which is a bunch of cotton.
The common sense sort of way you're putting this over, I think it's very good.
Yeah.
It's very
Well,
good.
it is kind of casual because even though I don't deny that it's definitely a traumatic thing to go through and that I didn't have, you know, fears
Well,
as
especially
well.
on the particular occasion
Right.
that you were faced with it.
Well, that was very
more
helpful,
so.
though. It was very helpful because there was no doubt in my mind that he would split because he was a leg man anyway. And he was tremendously supportive, and we went right ahead with our plans, and I was married a month from the date of the operation. And so there wasn't a whole lot of time to, you know, I got things taken care of very quickly, and I showed him my scar immediately, and I got rid of all those problems, and I slept with him as soon as I came home from the hospital and got that out of the way, and, you know, I sort of had to, you know, I figured. And,
Very sensible kind of outlook.
well, I just don't, you know, it's what you make of it, really.
We urge a couple that's had a mastectomy, for example, to touch each other as soon as possible. Indeed, while she's still in the hospital, perhaps even the first day post-operatively. And if the hospitals permitted it, if the administrators and the nurses permitted it, why, we would say that intercourse would be appropriate. But certainly, we would suggest that they engage in intercourse as soon as they got home.
If someone comes to sex therapy without a partner, the first thing we deal with is their self-image, the way they look upon themselves. And once we restore their self-esteem and help them to feel better as sexual beings, they can find a partner out there.
This is the general feeling that I have, that there's always somebody out there, if you give out the vibrations, that you are ready, willing, and able to have a partner.
What's the problem of guilt? I don't understand.
Well, the
Where does it come?
guilt arises by saying, what right have you to even imply that you are starved when you have a wife who's dying of cancer?
The question always comes up whether the well partner should seek sexual gratification outside the relationship or marriage. I think that's a very personal and individual kinds of question. In some cases, the couple might mutually agree, in fact, that might be done. On the other hand, there's some dangers to it. That is, if the well partner is already feeling a sense of guilt, and then they go have another liaison with someone else, that it might increase the guilt reactions and may increase the feelings of abandonment in the ill person. However, I can't speak for everyone's sexual needs, and if they're very strong and they're not being satisfied, then I think that they would have to be discreet in thinking about ways of getting some type of release.
We have talked about this, and don't think that on occasion I don't have strong temptations that way. I mean, I know one or two women as friends with whom it is not beyond the pale, you know, beyond the range of possibility that there could be a sexual relationship, though I have never proposed it in this way. But I think that the complications of the situation are enormous. First of all, I think that Joan realizes that I'm the kind of person who tends to get involved with people. I mean, that I don't just have a sexual relationship with people, normally speaking. And Joan realizes this, and she realizes that I'm not the kind of person to be able to make easily such a dichotomy. I feel that Joan has tremendous expectations of what I can be, you know, and what I can do. And the truth of the matter is that I can't meet her.
We have to recognize that sex is not always what a dying person may want. A dying person often feels depressed, and depression reduces libido, sexual interest, more than almost anything else. But the wish to be held and stroked and caressed probably exists on a very, very deep level for everyone.
I think it is very important for patients who are sick not to lose that kind of sexual caring that they have enjoyed in the past. There are many ways in which stroking the hair, stroking the arms, holding tight, these are all aspects of sexuality which I think are very important for sick people and very important for their partners, for the well partners who also have sexual needs during the time of illness.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Eric. Happy birthday to you.
Well, thanks very much, folks. Now.
The general physician, if he's looking after chronically sick people, should certainly be prepared to enter into discussion of the about sexual relationships and tenderness and caring. And that feeling of being wanted, of being cared for, of being loved, I think is something which we need even perhaps more than ever during a period of crisis from illness.
Some hot soup on my tray, that'll help. I was hoping for some nice chicken soup, but it's that awful bouillon.
Can you eat it yourself? Do you want me to do it?
Yeah, I'm going to drink it.
Is
It is a bit hot.
Well, it may be horrible, but I haven't had anything all day. It's pretty awful, but still.
In our culture, sex and intercourse are synonymous. We are a goal-oriented culture. We have to make it, we have to score, we have to increase the bank balance, we have to get that promotion. If we're playing tennis or golf, we have to be better than the next one. And in sex, that means having intercourse more often than the next person, having better orgasms perhaps than anyone else. And there are many, many ways in which to make love besides getting there.
To you?
It's important for people who are ill, even if their illness is rather far along, to understand that they can have very satisfying physical contact. The usual sexual experience is not the only satisfying experience.
We recently returned from a cruise where we were invited to present seminars and lectures and discussions to the passengers. This was a lay group, not a professional group. And most of the people on this cruise were older people. And as you might expect in a group of older people, there were people with handicaps, people with diabetes, a number with heart conditions, a good number. A few of them had kidney conditions, arthritis, and one had a spinal cord injury. And we recommended to these people that they do the homework, the sensate focus exercise, which we feel is an important part in getting people together. It was a most profound emotional experience where when the series of exercises and the lectures and seminars were completed, many of the couples actually came to us crying, saying it was a very moving experience, that it's been the first time in many years that they really touched each other. And as one woman said, you know, we did your touching exercise and we did the shower together and it worked.
We have to let people know more and more that talking about sex is important and appropriate, because even in healthy couples, there's a problem talking about sex, that even though people live together, sharing some of those intimate moments in an honest way and discussing them is hard. I see this as just part of the continual process of people opening up with regard to sexuality in this society.
In cases of serious illness, I think it's very important for husband and wife to demonstrate as much physical warmth and closeness as they can under the circumstances. Certainly as much touching and loving as can be demonstrated. I think it's very important for the person and a real part of healing in a total sense, of making a person feel whole.
Departmental session.